All right, so welcome. Today we're going to be talking about your cardiovascular health, and we're going to give you some good tips and tools to be able to improve your overall health and well-being, but our focus is going to be on heart health. So, with that said, my name is Abby Horton, and I'm a registered nurse, a certified health and life coach, a wellbeing ambassador, and your wellness class educator. And I have put my email at the bottom of this slide. It's abby.horton@ua.edu. And if you have any questions or want to reach out after this presentation, please feel free to send me an email. So for the class, we want to talk about healthy habits, and we want to talk about ways to reduce your cardiovascular risk factors. So not just that we want to prevent heart disease or heart attacks, but also that we want to really be mindful about our blood pressure and our risk for stroke. And so we're going to give a good overview of all of those risk factors and some healthy habits that you can use to eliminate or reduce those factors. And so we want to understand the relationship between cholesterol and hypertension. We want to be able to look at the risk factors for high cholesterol and hypertension and how that can be changed with diet and exercise and other lifestyle choices. And then we also want to look at healthy habits that are going to not only reduce those things, but also set you up for good health overall. So with cardiovascular health, this is really talking about the health of the heart and the blood vessels. And so that's when we also talk about stroke, and we talk about good brain health, and we talk about high blood pressure, and all of those things tied in together. And so there are several risk factors that can lead to the development of cardiovascular disease. And so high blood pressure is definitely one that we think about, but also high cholesterol, tobacco use, and diabetes. And with diabetes, we want to think about inflammation. And so if you have chronic inflammation or autoimmune conditions, you also may have a higher risk. There's also some genetic components, and so those are all things that we'll talk about as we move through the presentation. So the Go Red for Women for the American Heart Association movement has this acronym, and it's Go Red, but many people don't realize that it stands for Get Your Numbers, Own Your Lifestyle, Realize Your Risk, Educate Others, and Don't Be Silent. And so when we talk about getting your numbers, we always say you need to know your numbers to really be healthy. And so to know your numbers, that means we want to know your BMI, your weight. We want to know your cholesterol, your blood pressure, your blood sugar. We want to know all of those good lab values that you get when you go for your annual visit. And we want to make sure that not only do we know it as a provider, but that you as the client or the patient knows that. And then own your lifestyle. So we have to really look at the things that we do on a daily basis that may hinder some progress that we're having with our health, but also that may be helping it. And so we want to add more of the good stuff in, and then eventually kind of weed out or eliminate some of the other things that may not serve us as well. And so really owning the lifestyle choices that we make, we do have a good bit of control over how much some of our genetic risk factors end up coming to fruition. So we are not destined to become our genes, that we have. We definitely can have risk factors for certain things, but that doesn't mean that we're actually going to develop those diseases. And so environment and lifestyle choices do play a big role in our genetics and in our overall health. We want to realize our risk. And so if you have, previous conditions, or maybe you have some of the conditions I mentioned on the previous slide, or maybe you have a strong family history like I do for heart disease and for heart attacks, then it's just important to know your risk factors and to know that you may need more monitoring, or you might need more, I would not want to say restrictions, but maybe more awareness about some things you might want to restrict in your life. And so for me, I know that I need to have more frequent preventative health screenings. I need to do more with my diet and exercise. I need to be more aware of my cholesterol and my BMI and things like that. And so I have to be more careful about that, even though I'm not in the age group that you would typically think about being at risk for heart events or things like that. You also want to think about educating others, particularly if this is something that is a concern for you and your family, that you are able to educate your family and able to share some of the things that you learned here in this presentation, and hopefully that you continue to learn throughout our other wellbeing programming. And then don't be silent. And this is not only that you're educating others, but that you're also advocating for others, and that you're, making sure that if you have a condition, a problem, a symptom, a sign that we might discuss here, that you're not silent in terms of, you advocate for yourself with your family provider, whether it's a physician or nurse practitioner, but also that you're not silent in the sense that you're, really advocating in your communities for good heart health. Heart disease, cardiovascular disease is one of the top 3 lifestyle and disease processes that will impact and kind of, be one of the top 3, what we call, killers, quote unquote, in the US. And that sounds very harsh and very severe, but it is one of the top 3 because there can be so many complications. And so we don't want to focus on that. We want to focus on what we can control. And what we can control are the lifestyle changes that we're going to talk about today. So with cholesterol and hypertension, I like to explain the relationship between the two because we often don't think about what we are doing on a daily basis that impacts our heart health. And if we think about the heart being a fancy muscle, I think that will really help you when you are going through the presentation and really digesting this information, because we think about the heart in different ways and we often forget that the heart is a fancy muscle. And that's why when we get dehydrated, when we do cardio, when we do lots of things that would strain or stress a muscle, we're doing those same things to our heart. And so we have to think about it in those terms. And that way it makes a really practical, kind of sense when we think about things that we can do to improve our overall health. And so with cholesterol, when you have high cholesterol, you can get cholesterol deposits in the vessel. And so when you see right here, this illustration, it's showing that there are little deposits of cholesterol that eventually can occlude or close off the vessel. And so if I get too nursey or too technical, y'all just let me know. But I think this will make good sense. We're going to be really practical, use lots of examples and lots of graphics. But basically that high cholesterol, those deposits close off that vessel, and the narrower that vessel gets, the higher your blood pressure is going to be. And so we often talk about cholesterol and hypertension being quote unquote bad. And we often don't, though, talk about the relationship between the two. And so we say in medicine all of the time, and in healthcare, that blood pressure is a silent killer. We say those words all of the time, but really blood pressure being high does usually have signs and symptoms. And so it's really cholesterol for me that I think is the silent killer, because cholesterol often is going to be high before your blood pressure is high. Now you can have high blood pressure and not have high cholesterol. We see that, that's definitely a possibility. But blood pressure is a lot of times high because cholesterol is high. And when the cholesterol is circulating in that blood vessel and narrowing off that space, then it's like kinking a water hose. If you put a kink in your water hose outside, or if your water hose is older and it gets a lot of build up in the tubing, then you know that the pressure in the water hose changes. And so that's what happens with our vessels, is that the pressure has to get, higher, it has to get greater, right? If it's a water hose, to get past all of those, deposits of dirt and grass and whatever gets in our water hoses. And so that's like the cholesterol in our vessels. So the pressure gets higher in the water hose, the water gets a higher pressure. Well, our blood gets a higher pressure too, to overcome and bypass those narrowed spaces. And so blood pressure being high, you're typically going to see someone, once you start to have symptoms, you're going to see them have headaches frequently. You're going to see that they maybe, feel a little lightheaded. Maybe they feel just a little off or fuzzy headed. But headaches are going to be really characteristic of high blood pressure, okay? With cholesterol, you're really not going to know unless you get that value checked. And a lot of times until you go in either for a well-being screening or maybe an annual exam, you're not routinely getting your cholesterol checked. And today, with all of the high fat and processed foods that we have and the chemical-laden foods that we have here in the US, we are seeing more and more people who are younger and younger having high cholesterol. And we're talking about elementary school age children having high cholesterol. And it's because they're eating highly processed foods for the most part. And not just fast foods from a fast food chain, but also from the grocery store. There's more processed food than not in a grocery store. And so that's when we tell you to really shop the perimeter or the outside of the aisles, because that's where your fresh produce and cheeses and things like that are. And so when you're thinking about making changes, just know that it's going to start with diet, because cholesterol is going to be the first time where you're seeing these things change in your health. But oftentimes you're going to be diagnosed with high blood pressure before you're diagnosed with high cholesterol, because you're going to eventually have that headache and just not feel well. And then they'll do your labs and they'll do your vital signs and they'll say, oh, well, your blood pressure is high and we noticed that your cholesterol is also high. So definitely make that connection so that you understand that there's two different things going on there. And it just so happens that you're probably going to find out about your blood pressure before you find out about your cholesterol. But the cholesterol is where we need to start. And so we think about cholesterol being, good and bad. In the US and just in the world in general, we like to label things, and we certainly like to label things in healthcare. And so we like to say that things are good for us or bad for us, when really things are just necessary, right? So cholesterol isn't bad. We need cholesterol, but there are different types of cholesterol that we need to be aware of. And so cholesterol, you can have LDL, HDL, and you can have this, relationship where we consider the LDL to be the not so great cholesterol and the HDL to be the better version of cholesterol. But we're going to break that down. We learned it in nursing school as L was lousy. It's the not good version of cholesterol, and HDL is the quote unquote healthy version, but you actually need both. And so cholesterol is naturally found in our bodies because of the hormonal imbalances and balances that we have, kind of the checks and balances system within that. And cholesterol is found in the foods that we eat. And when we take a cholesterol value, when we do blood work, it doesn't differentiate really between what we're ingesting and what's naturally being made in our bodies. And so every cell in our body requires cholesterol. And what I would really like for you to have as a takeaway from this presentation is that if something's naturally made in the body, then it's not bad because we need it. Our bodies don't typically make things that we don't need. And so cholesterol is needed for hormone synthesis, so making hormones. That's a building block of all hormonal processes that are made in the body. Vitamin D production, we think about vitamin D being a supplement or being something that we get from being out in the sun, but vitamin D is a type of hormone. And then it's needed for other normal body functions, which is why it's needed in every cell of the body. And there's definitely a relationship between the cholesterol and the red blood cells. And so a lipoprotein is composed of cholesterol, protein, and fat. And fats can also be called triglycerides. And so when you get your blood work done at a doctor's office, triglycerides are going to be something that they look at. And that means how much fat is available in that bloodstream. And so fat is not bad. Fat has been something that we have been told to avoid for many years, but we do need good, quote unquote, healthy fats. And so we'll talk more about that, but fat is also needed by the body. So cholesterol is a soft, fatty-like waxy substance found in the bloodstream and in all cells of the body. cholesterol is normal and it's healthy and it's needed for your health. And your liver makes cholesterol. And so, like I said before, your body is going to make this cholesterol. Your liver has a function to do that. And then you also will get cholesterol in foods, so meats and dairy products. And you definitely can get it from other processed foods that are packaged, that you will find in the grocery store aisles and fast food chain restaurants. And so your body needs cholesterol to work properly, but when you have too much cholesterol in your body and in your blood, it does raise your risk of coronary artery disease. And so that raises your risk for cardiovascular events or cardiovascular disease. Because what happens is when we have too much cholesterol, there's not really anywhere for that cholesterol to then properly be stored. And so then it gets deposited in those vessels, and that's where that narrowing of the vessel happens that eventually leads to high blood pressure. And so I mentioned types of cholesterol. Triglycerides are the third component of that. And those triglycerides are those fats that are in the bloodstream, because again, fats can be stored in our body in our what we call subcutaneous tissue. But fats, when we have even more fat than we can store in our tissue, then that would be stored in our bloodstream. And so that's definitely something that we want to make sure when we see our triglyceride numbers, that those are within the normal limits, because we don't want to have extra fat deposits in addition to the extra cholesterol, because then that is going to be problematic for when we're trying to really look at having a healthy blood pressure and healthy vessels. So the function of HDL and LDL. I love this graphic, and I really had to use this kind of graphic to explain to myself and to explain to others why, nothing is inherently bad in our body. So we've got our liver here, and we've got LDL that is, made by the liver, and it's carrying the cholesterol to the cells. So the LDL is kind of like the transporter of the cholesterol to the cells. And then when it gets to the vessels and, it starts to circulate, the excess cholesterol that's not needed by the body, it has to have another way to get back to the liver. And the HDL is the other type of cholesterol that is used to get the excess cholesterol from the LDL back to the liver. And once it gets back to the liver will break it down, or it will reuse it, okay? So the issue comes in when you don't have enough HDL. Those HDL helpers can't get all of the LDL back to the liver if the ratio between the HDL and the LDL is not in the right proportions. And so if you've got too much LDL and it's not used by the body, and there's not enough HDL helpers is what I would call them, to get the excess back to the liver to be reused or to be broken down, then that's when you start to form those deposits of cholesterol in the vessels. And we know those to be plaques. And plaques in the vessels, when we talk about having a cardiovascular event, this is not a pretty scenario, but I'm going to give it to you because it perfectly illustrates what happens. It's like a zit or a pimple that pops. So if you have, ever experienced that, we probably all have, right? And how it kind of ruptures, how that zit will pop. That's what the plaques will do. And so when you have a tear in your blood vessel, when you have a cardiovascular event like stroke or a blood clot that gets thrown, something like that, then it's the plaque that kind of pops and ruptures almost like volcanoes, and it can break those vessels, or it can completely occlude or close that vessel off. And so when we talk about LDL and HDL, we want to make sure that we have enough HDL on board, that HDL is high enough that it can help get that LDL back to the liver. So that's a critical component of this talk, because a lot of us don't have super high LDL levels, but our HDL levels aren't high enough to make the LDL be a safe or effective level. And I know that was a lot of talking, but if it doesn't make sense, just let me know. You're welcome to unmute or put your questions in the chat. I think it'll make sense as we continue to go. So with your triglycerides being that type of fat that's stored in the body, it's the most common type of fat. And so things like butters and oils and other fats that you eat will actually get stored, like I said, if you don't use it and you don't, burn that off. It can be stored in our tissue, but the extra beyond the tissue is going to be stored in the vessels. And so you want to make sure that, your triglycerides are going to be in that normal level, that normal range. And you want to make sure that your caloric intake is a healthy level, because a lot of times the extra calories that we're eating have those extra triglycerides. And I'm going to look at the chat to see. How can we raise our HDL? Yes, we're going to cover that for sure. Thank you, Amy, for the question. So these are the calories that you eat, but your body doesn't really need right away. And so you could be storing those calories up. And that's not inherently bad, because we do need some storage for having energy. And, that's how we have an energy reserve. We pull from those fats when we're cold or when we're, needing to do, some intense exercise. So having some stores of fat is needed. That's why our bodies do it. It's just making sure that we're aware of the relationship of all of these things and making sure that we're being really consistent with our day and with our routine, because it's the inconsistency of eating and exercise where we're putting a lot of strain on our body. So, if it's feast or famine, if we're doing that to ourselves in terms of we're exercising really hard today, but we might not exercise for 2 or 3 more days and we're not in a pattern, or we might eat a lot of calories today, but we won't eat hardly anything tomorrow, it puts a lot of unnecessary and unnatural stress on our bodies, because our bodies are trying to find a pattern and get into a rhythm. And if we're kind of yo-yoing with all of those lifestyle habits, that can be really stressful, and that can start to impact our hormone imbalances too. So think of that. Think about your body needing energy and using those triglycerides as a way to get that energy, but being mindful not to overeat foods with a lot of fat. Okay. So types of fat, this is really important. We don't often look at anything on the food label beyond the calories. And I am including myself in that, because that's really what we've been trained to do. Unless we're a nutritionist or registered dietitian, we don't often look at the backs of our food labels for anything other than maybe we look at the vitamins, maybe we look if we have an allergy to make sure there's nothing there. But a lot of times we're fixated on the calories, and the calories don't always give us enough information to know whether it's a good food for us. And I say good as a relative term, because what's healthy for me to eat is probably not going to be the same, healthy version for you, right? We're all very different. And so for types of fats, we know that we need those for our brain. Our brain definitely appreciates when we eat fats. If we feel really tired and fatigued and foggy headed, and we're eating really low calorie diets, or we're eating really low fat diets, our brains are not working optimally, particularly when we replace processed foods that are considered quote unquote low in fat. If you have a product that you're eating that says low fat or reduced fat, then that means that they have added sugars and they've added chemicals to make that be something that's tolerable to eat. And so you want to make sure that you just do most things in moderation. Not all things are good in moderation. Some things you do need to avoid, but most things in moderation is the best approach, in my opinion. And you want to make sure that you're eating, real whole foods and less of those things if you're concerned. So instead of eating margarine, eat less butter. Eat butter, but eat less of that butter. Don't, use things like margarine that are going to have more chemicals in them. If you want to reduce your sugar intake, then, have real sugar, but don't have it be a substitute like, some of the, sugar substitutes that are more really chemical laden. Stevia is usually for most people the best choice, but stevia can cause people to have headaches. Monk fruit is another one that's a favorite sugar substitute that would be appropriate for a lot of people, but again, you can have some sensitivities. But a little bit of sugar, being reduced would be better for most people than to have things like, sweet and low or something like that. So moving forward with saturated fats, those usually come from animal fats. So this triggers the liver to make excess cholesterol. And so when you eat things that have a lot of animal proteins, especially animal proteins that are more difficult to digest, so red meat, for example, it's a great source of iron if you need iron, but it can really have a burden on your liver if your liver is having trouble processing things like that. So you just want to make sure that you're aware of what your body needs and that, you're aware of the relationship between all of the things that you're consuming and eating, because for every one of us on the call, your needs are going to be different. And if you need specialized help, we have lots of great resources I'm going to tell you about so that you can get a plan that works best for you. With trans fats really aren't fats. Trans fats are chemicals, and so they are man-made or human-made food preservatives. And so when you're eating trans fats, it's not a true fat, it's a chemical that has been introduced to make sure that whatever you're eating has, been preserved, that, it's sweet enough for you to eat, those types of things. And so you want your trans fats on your nutrition label to be 0. And when you have saturated and trans fats, you're going to have excess cholesterol. And that is very, prevalent in our society today. What we call the standard American diet, or SAD, is the technical name that people will use. And the standard American diet is heavy on saturated fats, processed foods, and trans fats. So unsaturated fats are good for you, and those are what people usually call healthy fats. And those are going to be things like nut butters and avocado and things along that line. So with triglyceride normal levels, it's really important to know your baseline. And so your normal level, you want to have triglycerides less than 150 mg per DL. And what that means is that when you get your numbers back, you want it to be less than 150. And that's telling you that you have less than 150 milligrams per deciliter in your blood of your triglycerides. So that means that you're not storing extra, fats or fatty deposits in your bloodstream. Over 150, you're going to have more of a risk for a cardiovascular event or heart disease. And so you have the different levels here of borderline high, high, and very high. And so it's not uncommon to see people in the populations that I see to be borderline high or high. That's not uncommon at all. And so you also have a risk for something called metabolic syndrome, and that is where you have a risk for heart disease and diabetes and other endocrine disorders. And so you definitely want to know your numbers so that you can start to make some progress on how to improve. So again, this is another good depiction of how you can look at the ratios with HDL and LDL. And so this talks about, kind of how this all looks and how often you should be screened, which I think most people should be screened when you go for your yearly annual exam. For cholesterol, we certainly do that as a benefit to you with wellbeing programming. So you can sign up for your health screens and get that checked and get your blood sugar checked. But one thing I want to point out here is that your total cholesterol is looking at your cholesterol, your LDL, and your HDL, plus your triglycerides divided by 5. And so this is how you look at your total cholesterol. And the reason that I put this here is that when you go to get your, annual exam or get your blood work done somewhere, a lot of times they're only going to tell you your total cholesterol. Be sure that you ask for the breakdown of your LDL, your HDL, and your triglycerides, because if you just see that your total triglycerides or your total cholesterol is 300 and you don't know the breakdown of each of those 3 components, you don't really know what to work on and improve upon, because you could have really high HDL values, which would be good, and you could be okay on your cholesterol, but maybe have high triglycerides or vice versa. And so it's important to know each of the components so that you know where to put your time and attention. Because if you have high LDL versus high triglycerides, that's going to be different dietary choices and different dietary, kind of protocols to get that under control, versus, some of the other things that you would need to do. So that's important to know. So always ask for the breakdown and don't just look and take the total cholesterol at face value. So the downside of excess cholesterol, we've talked about this a little bit, but kind of moving forward, excess cholesterol is going to really accumulate, like we talked about, in that vessel and cause the narrowing of what we say the arteries, or we're worried about coronary artery disease. So when we have this, kind of progression across the screen where we're looking at hypercholesterolemia or high cholesterol or atherosclerosis or heart disease or heart attack and stroke, what it's saying is that we have high cholesterol, we start to have narrowing of the arteries, we end up having heart disease, and that can lead to heart attack or stroke. And so it's important to know that there aren't any symptoms of that high cholesterol, and we start to get some as our blood pressure gets increasingly higher. So early on with our high blood pressure, when we first start to have symptoms or signs that it's rising, it's probably already in that high risk category. So your blood pressure typically will be high for a little while before you start to have the headache and brain fog. And so that's why it's so important to get preventative screening, so that you catch the high cholesterol and you catch the high blood pressure early. So health concerns with cardiovascular health. You can have heart attack and stroke, but you also can have poor circulation, and you can have the high blood pressure. You can even have low blood pressure if it's fluctuating, if you're having plaques or those deposits released. And so it's not just that you have high blood pressure, it may be that you have this variable blood pressure that occurs. So, periods where it's really low and periods where it's high. And so those are things to really think about as you're looking at your overall health. And then this is another way to show your arteries or your vessels that I've been talking about. So the initial stage of atherosclerosis, or that narrowing or plaque buildup, in that second photo is where the cholesterol plaque just starts to form. And then you have significant cholesterol plaque in the third photo. And then you'll notice in the last photo, which is why I included it, this is considered a complete blockage. But I want you to see that a complete blockage here is not 100%, because you can still see some red in that fourth photo. And so a complete blockage for this, for cardiovascular health, is going to be around 70 or 80%. So our complete blockage is not 100%, but it's going to be around 70 to 80% blockage, because that's where you're going to see your, severe symptoms. You're going to start having chest pain. You're going to start having a lot of symptoms, and you're really not going to be able to function at 70 to 80%, which is why it's called a complete blockage, even though when we hear that, we think it's 100%. So that's why I included this graphic. So inflammation is what I really want you to think about, because with inflammation, we have so many high levels of cholesterol that we can have excess LDL that begins to really seep into other areas of our artery. I apologize for my phone. So we can have inflammatory response that can accumulate And the cholesterol in the artery wall can actually start to set off an inflammatory response. And this is very true for those of us who already have a propensity to having inflammation. So if you go and you eat a donut after work today, or you go and have some pizza after work, and you feel really puffy and you feel like you have a lot of fluid on board, and you wake up tomorrow and you've seen a 2 or a 3 or a 4 pound weight gain overnight, then you're probably someone who has a propensity for retaining fluid and having a lot of inflammation. Because even eating something that you're a little sensitive to, like gluten or pizza or carbs, you wouldn't expect to see that dramatic of a weight gain overnight. And so that is one indicator that you might have some inflammation going on or some food sensitivities going on, whether it's that you're sensitive to carbs or that you're sensitive to gluten. I mention that because so many Americans are really struggling with inflammation and autoimmune conditions. And women are more likely to have autoimmune conditions because of the way that our immune system is designed. We typically can see more autoimmune type symptoms, particularly if you've ever had a child, because that will alter your immune system and your immune response during the pregnancy. And so that's not true for everyone. It's not true for all women, but women do tend statistically to have more autoimmune and inflammation conditions. So this is important to note as well. Inflammation is really the basis of all of the major conditions that we see today. So heart disease, diabetes, dementia. Inflammation has been found to be one of the initial root causes because it's really causing our body to form a response every day that we're having this high inflammation. And so if we can get rid of inflammation or reduce inflammation, that's really important. And I'm going to talk more about that because there's different types of inflammation and there's different practical things you can do based on what's causing the inflammation to start. So again, some warning signs of plaques that can cause what we call clogged arteries. There's lots of names we refer to this as, but the stroke we mentioned, but fatigue and dizziness, that foggy-headed feeling, those headaches. You can have shortness of breath, you can have chest pain, lower back pain, which a lot of people don't know about. You can have erectile dysfunction because of those, closed off arteries. And then because of that, the poor blood circulation that you can have painful numbing, or cold hands and feet, or just, a lot of pain, or what's called peripheral neuropathy. So there's lots of things that can feel unrelated that might actually be related to, a cholesterol or, a plaque issue. So blood pressure, we mentioned what this is, but again, it's just the force that requires the blood to go through the arteries that's pumped by the heart throughout your body. And so when that pressure increases, the heart's beating and it's going to have to decrease to let the heart rest. And so that's why you have that variability in your blood pressure, because it's all about when the heart's beating versus when the heart's resting, and when the blood is, being pumped, and when the blood is returning. And so that's, again, a great way to look at kind of a water hose, because we have a lot of probably experience with how that can work. And so we have to really be careful about making sure that we check our blood pressures and that we do it consistently, because our blood pressure, like everything else in the body, will fluctuate throughout the day. And so when we get up in the morning and we're rushed to get to work, our blood pressure is probably going to be higher than when we're getting ready to go to bed at night, or at least that's what we would anticipate. And so checking your blood pressure, your blood sugar, and all of those other good numbers that we like to have a good, kind of baseline for at different parts throughout the day is really important. And if you're having any symptoms of anything related to heart health or otherwise, tracking what times of day you see those symptoms, what days of the week, is there a pattern? Tracking those things can be really helpful, particularly tracking it along with how well you're sleeping, the things that you're eating, the amount of stress you have, the day of the week. Those can all be really good indicators for figuring out what may be going on at the root of your problem. And then here you can see the blood pressure impact as the narrowing occurs, going from a normal blood pressure to hypertension. And we do have pre-hypertension. And so that is where your numbers are a little elevated, but it's not to a clinical level of hypertension. And so what I want to make really clear on this part is that you can have high blood pressure without having a clinical diagnosis of hypertension. So hypertension is the medical diagnosis that your blood pressure is high. But we all right now could have high blood pressure if we were told that we had to go to our boss's office. You know, my blood pressure would get high. Would your blood pressure get high? If we were told that we had to make it somewhere in 20 minutes, you know, we had to leave and in Tuscaloosa traffic, get across town, our blood pressure might get a little high. But that doesn't mean that we have a clinical diagnosis of hypertension. And so that's why it's so great to get readings and to know how much it fluctuates and when it's fluctuating. You typically have to have 3 readings to have a hypertension diagnosis. And so think about that. If you're not going to the doctor's office very often or seeing your healthcare provider very often, then that means that it could take a year to 3 years for you to get a diagnosis of high blood pressure if it's not something that's on your provider's radar, and if it's not something that you're going back for frequent checks. If you're just doing annual visits, it could take a while for you to get diagnosed. And so the first time that you see a high reading for your blood pressure or cholesterol, you definitely want to follow up at your provider's, kind of direction to make sure that you're not waiting until the next year to see that the problem has progressed even more. Because if you can do early intervention with some of these things when you start to see your numbers get higher, then you really have a good chance of preventing, complications or the progression of a disease that might not happen if you can do some lifestyle changes. So again, monitoring your blood pressure closely is so important. And the new guidelines, we always said that 120/80 was a great blood pressure, and it still is, but we really want to see that your blood pressure is less than 120/80. It definitely can impact you if you have a low blood pressure though. And so if you have low blood pressure, you want to make sure that it's not too low, because then that's going to impact your fatigue, your foggy headedness, you can have headaches. So when you have high or low blood pressure, you really can have a lot of the same symptoms. And so you just want to make sure that you understand what those symptoms are, indicating for you. And so definitely look at this, chart and kind of see how there are different stages now. So it's not just all hypertension in one category. You can have the yellow, which is the elevated. You can have high blood pressure, which is the hypertension stage 1. And then you can have the high blood pressure hypertension stage 2, and then you can actually have hypertensive crisis. And so the elevated or yellow column is what we would call pre-hypertension. So at the pre-hypertension level, based on your health history and what's going on in your life, you might actually start to get medicine at that level because they don't want you to get out of control with your blood pressures. And blood pressure medicine is something that can be weaned off if you can get to the root cause. So for some people, it might be stress. For other people, it might be high cholesterol. For others, it might be, a sudden weight gain that causes extra fatty deposits. There are lots of reasons that you could end up needing a blood pressure medication. And so there are opportunities for you to make lifestyle changes and actually come off of those under the supervision of a doctor or provider who is monitoring you and giving you that medical advice. And so I want you to be encouraged that while you might need assistance with medication, that doesn't mean that you don't want to try the other lifestyle modifications and you don't want to, actually explore some other options once you're able to get some of those things under control. And so here you have the blood pressures and kind of looking at it in a different format. but it talks about the different recommendations. And so, if you're in the pre-hypertension stage, you want to make sure that you're reassessing your lifestyle choices and your blood pressure at 3 to 6 months. If you're in stage 1, it has recommendations for you. If you are in stage 2, it has, different recommendations. And so these are great ways to kind of check in to make sure that you're monitoring your health and you're on top of your numbers. So here are some symptoms again. We don't think about talking about hypertension symptoms beyond just having a headache, but you can have shortness of breath, nosebleeds, a flushed face, feeling dizziness, chest pain. Your heartbeat can get erratic and irregular. You can feel like a pounding in your chest or neck or ears. You can have visual disturbances, which is really, really common. Less common, you can have blood in your urine, and then of course you can have fatigue or confusion if it gets to be really severe. And then again, I mentioned this, that you want to make sure that you have 3 or more readings that indicate that you do have a hypertension issue. And so many people get dismissed with this because they think about white coat syndrome, which is, oh, well, my blood pressure is just high because I rushed to get here, or my blood pressure is just high because I'm nervous about being at the doctor. But you want to make sure that if it's high when you first get to the office and get it checked, or to a well damage screening, that they recheck it at the end of your appointment, or at least after waiting 5 or 10 or 15 minutes, to make sure that you get a more accurate reading for what that is, and even that you're monitoring those at home, or going to grocery store or a pharmacy to be able to use one of the actual machines that can give you a reading if you can't take these at home. So other health effects, again, beyond what we've already mentioned, you can have sexual dysfunction, kidney disease, and you can even have some issues with your eyes and vision loss. So those are all things to note as well. And then the impact of hypertension, about 75 million Americans have high blood pressure. And so that's 1 in 3 adults. And then 1 in 3 adults have pre-hypertension. And so only about half of the people with high blood pressure actually have it well controlled. And many people don't know that they have high blood pressure. So some risk factors for having high blood pressure: stress, we know this is an important risk factor for so many conditions. Substance use, obesity, diabetes, our salt intake. And salt, when we're talking about this, we're talking about table salt that's really refined and processed. We're not talking about Himalayan pink salt, and we're not talking about Celtic sea salt. Those are usually really good for you because they have usually up to 66 trace minerals that really help with your fluid balance and your overall health. So with salt intake, we're really talking about sodium, and we're talking about processed and refined table salt. Overly processed diet because of all those chemicals and the sodium, caffeine consumption, and then things that you can't control as much, which is your family history and genetics, your ethnicity, because really that relates back to your geographical area, and our geographical areas really have a lot of impact on our environment and that sort of thing. Age, and then of course our assigned, biological, chemical gender. We know that there are some differences based on hormones that we have on board, and so sex really relates more to the hormonal factors and some of the genetic components, more so than lifestyle behaviors. And then treatment. We can have lots of different options for treatment that's traditional through, medication. Diuretics are usually a first-line defense. Things like ACE inhibitors, beta blockers, calcium channel blockers, those are all medications that you could be prescribed. And diuretics are usually the first thing that your doctor or provider is going to prescribe beyond the lifestyle choices that you can make. And then diabetes. I like to mention diabetes with cardiovascular health because with the extra glucose that you can have on board with diabetes, it can damage your blood vessels. And that's why you're at risk for peripheral neuropathy, and you're at risk for dementia, and you're at risk for heart events and stroke, because that sugar that's circulating around, or glucose, can actually damage your blood vessels in your body. And so so oftentimes you will see people who have high cholesterol with diabetes and high blood pressure, and that's going to be that metabolic syndrome that we talked about. And so again, you can have a lot of issues with poor circulation, peripheral artery disease, you can have kidney disease, and then we think about diabetic retinopathy with your eyes, cataracts, and glaucoma. So a holistic approach to health. You know, I never like to talk about the problems that we face without talking about how we can start to solve some of those, okay? And so after hearing all of that, that can be discouraging for some to think about all of the risk factors, particularly if you have risk factors that you can't control. But what we're going to focus on now is controlling what you can control. And so there are 7 steps to a healthier heart, and it talks about living smoke-free, but also tobacco-free, monitoring your blood pressure, maintaining a healthy weight, watching your cholesterol, your blood sugar, getting active, and having a heart-healthy diet. So kind of this mentality of, you know, water first and veggies most, drinking a lot of good water, having half of your plate be vegetables, and having a more plant-based approach to your food, making sure that you're, you know, actually getting out and walking and having activity at least typically 3 to 5 times a week for 30 minutes or more, and making sure that those numbers that we've talked about, you're really monitoring and controlling them as much as you can. You often can't control what the number is on the reading, right? You can't step on the scale and wish that it's the number you want it to be. But you can do the things that you know that are going to help that number be what you want it to be by, you know, changing your diet or increasing your exercise. And so try not to focus on the part that you can't control, because you can't control your cholesterol, your blood sugar number, you know, on your blood work. You can't. But you can control the things like your sleep and your stress and your food, and, you know, start to make those healthy choices, and just know that it's going to take time. Your body is going to have to get used to this new lifestyle, and it's going to have to trust that you're going to keep this routine, and then your body will eventually start to respond. And so if it's slow going when you start to make changes, just know that the changes will come, but it's going to take a little bit for your body to adjust. So I always like to tell people when they don't know where to start, this is why I have the little start here pin, is, you know, regardless of what troubles or challenges you're having, whether it's stress or whether it's heart health or whether it's starting new habits, or, you know, maybe it's any number of the other things that we offer through Wellbeing, any of the other talks that we do, I always like to include the 5 to thrive. You know, we want to make sure that these 5 things that we're talking about here, they're really foundational to your health, and we want to make sure that you're controlling these things first. And again, to the best of your ability. So we want to make sure that you're sleeping well, that you're staying hydrated, that you're striving for a healthy plate, that you're moving your body every day. And that doesn't mean that if you've been pretty sedentary, especially with the pandemic, maybe your lifestyle completely changed, right? And you're just really still maybe in surviving mode right now. You know, you're just trying to survive the changes. You might need to start slower. And so it doesn't mean that you're going to sign up for a 5K tomorrow, but it might mean that you have a dance party in your kitchen tonight after dinner, or while you're waiting on dinner to cook. It might mean that you take your dog out for a walk tomorrow when it's not so rainy. It might mean that you park a little further away from your building to walk in tomorrow. Those kinds of things of just having extra meaningful movement in your day. And then meditating 3 to 5 minutes a day. And I like to use an app for this because I think it helps you when you have a guided meditation to walk you through, versus just trying to sit and kind of be, you know, on your own thinking about how to meditate. And so we're going to talk a little bit more about that. So with sleep, here are some tips for sleep. I like for people to be in bed by 10. I'm a night owl, so that's really hard for me. Having a night routine can really help, making sure that you don't have any blue light exposure from TVs or computer screens or phones or things after 9 can be very helpful. Keeping your room cool and dark and quiet can help. Having a noise machine or a fan, those are all great things to help improve your sleep. So these are the 5 things that I recommend that you do to start impacting your sleep. Sleeping 7 to 8 hours nightly, we often think about the quantity of hours that we're getting, but I want you to focus on the quality of hours, because you're going to feel better if you sleep 6 to 7 hours and the quality is good. You probably are going to feel better than if you got 8 or 9 hours and the quality wasn't good. Hydration, you want to set a goal for yourself and track your progress. We often tell people to drink 64 ounces of water or 8-ounce glasses of water a day. But the new recommendation is to drink about half of your body weight in ounces a day, usually no more than 100 ounces. So that's a good goal for you, and you want to track this. So if you only drink 1 or 2 glasses of water a day, then just start by increasing and drinking 3, and then add in 4. And then once you get to that 64 to 100 ounce range, start seeing where you naturally feel your best, because you definitely can overhydrate and you can have water toxicity. And so you want to make sure that you do what's best for you. And these are just our general recommendations. On a day where I'm going to be teaching and talking a lot, I'm going to need more water. On a day where I'm doing cardio for exercise, I'm going to need more water that day. But on days where I don't have those things, I don't need as much water. You want to make sure that you always have your water bottle with you, that you make it fun, add fruit and herbs and things to make your water be fun and infused. Things like, LaCroix and other sparkling waters are great. Just make sure they don't have added chemicals or calories. And then eat for health. So don't eat for weight loss, but eat to nourish your body. You want to eat a balanced meal. You want to make sure that you have a protein and complex carbohydrate and healthy fat at every meal. And that really helps stabilize your blood sugar levels and keeps you from having those dips in your blood sugar. You want to make sure that you eat the rainbow. So don't just eat green and beige. That's what we tend to eat. If we're going to be healthy, we grab something that's green. Otherwise, our food's pretty beige. And so make sure that you're having, good, reds and greens and yellows and purples. Eat the full, spectrum, because that's going to get those good antioxidants that you need. Each color has a different antioxidant that is primary in that food based on the color. And then track your meals with an app, track your meals and snacks, and then really aim to make one healthy change at a time so that you don't get overwhelmed. And then the DASH diet, I'm not going to spend much time on this, but just know that if you have hypertension, you're going to be recommended to eat a DASH diet. And the only thing I would say here is that they emphasize fat-free and low-fat products, and I would just recommend that you don't eat those processed foods with the low fats and the low the fat-frees, because those are going to have the more chemical laden chemical preservatives in there. But the rest of it really is helpful. It talks about limiting sugar sweetened beverages and alcohol and sweets and things. And certainly, not using table salt. They even have a Mrs. Dash's, spice line that doesn't have extra sodium in there. So DASH diet is something that you're going to hear about if you have hypertension. And then this is an example of a nutrition label. And this trans fat here, this is where I'm telling you that you want to make sure that that's 0. You don't want to have any trans fats in your foods. And when you add up your trans fats and your saturated fats and subtract it from your total fat value, so 2.5 and 2.5 is 5 from 11, so there's 6 grams of unsaturated fats. They don't list unsaturated fats on labels typically, and so just know that that's how you get your total fat. And then you can look at the other values there, but we want to make sure that you're looking at more than just the caloric intake. And then this is a breakdown of how to actually understand a food label. So it walks you through what you need to know in terms of even looking at the cholesterol or the sodium values are there for you. You want to make sure that you have good dietary fiber, and that you want to make sure you don't see extra sugars that are added into the products. And so a lot of times the label will say if the sugars are added. So, fruit's naturally going to have, sugar in there, but if you're using a product, it will have added sugars. And so just make sure that you're aware. And when you have a food that has a label, that's going to be more processed. Our strawberries, our bananas, Those greens and things that we get in the produce section don't have a nutrition label. So really the healthiest version of eating well for your body is to not be eating foods that do have a nutrition label. And that's a good indicator if it's processed or not. That doesn't mean that you shouldn't ever eat things with a food label, but that's a good rule of thumb if you're wondering if something's processed. And then there are some things that you can try. Turmeric can be really good for anti-inflammatory processes. Omega-3s, fiber really helps get extra cholesterol out of the body. More plant-based diet options and healthy fats. And then the things that we've already talked about limiting, which we know to limit: sugar, alcohol, meat, processed and fried foods especially, and then the avoidance of trans fats. These are all things, when Amy asked her question about how to improve your HDL, these are all things that are going to indirectly and directly improve your HDL. And so when we change our diet and we start eating more of the omega-3s, the turmeric, having more fiber in our diet, those are all going to be things that help improve our HDL. Particularly dark leafy greens can be helpful if you're not on a medication that makes that something that's not good for you. So if you're taking blood thinners and things, then you know that you have different dietary restrictions. So definitely consult with your provider for those specifics. And I see we have a question. Is keto diet good for you? I'll answer that question in just a minute. I know we're going to be at our time, but I'm going to just hang on because this is so much information to cover. And it's one I'm really passionate about because our heart health is really so important. So movement, again, these are some of my favorite things for movement. These here that I've listed are ones that are not going to be too high impact or too inflammatory. So you don't want to do a ton of cardio and hit, high intensity interval training and things like that. To start out, if you already know that you have a lot of issue with, inflammation, or you're a new beginner, you just don't want to start out with that intense workout. Things like CrossFit and all of that. Those can be great, but you have to be careful with those. So starting out with walking, swimming, yoga, those are great entry level, beginner level movement practices. And then let's see. So exercise, again, 3 to 5 times per week. And you want to make sure that your heart rate is up for that 30 minutes. And, if you can advance to a HIIT workout, those can be really great, especially for people who have weight loss resistance. Those can be, what's considered the ideal cardio, but it's not ideal for a beginner. You want to definitely work your way up. Because that can be hard on your body if you're going from sedentary to high intensity interval training. You're at risk for injuries, and we don't want that to happen. You want to use the BMI as just a marker, just as a tool, because BMI definitely, is not the gold standard for whether you're a healthy weight. It doesn't take into account all of the different factors and components. And so there are many, many components to whether you're a healthy weight. This is just one metric. So just use it as a tool. Losing about 10% of your body weight, though, can be really impactful and help your joint health, and really can improve your overall health. And so if you want to start with a goal, about 10% of your body weight is a good weight loss goal if you have extra weight to lose. And this just talks about how you can use the BMI as an indicator of health, but please know that this is just a tool to use. It's not the gold standard any longer. And then stress. We know stress affects the body, and it affects more than just how we're feeling, in terms of, brain health and our cognition, although that is a huge sign of, stress if we are irritable or moody or have brain fog. But it can impact every part of our body, every body system, because cortisol and adrenaline are released when we're stressed out. So we really want to make sure that we get to the root cause of our stress, and that we don't just band-aid our stress, and that we actually address the problem at hand, because long-term stress and chronic exposure to cortisol and adrenaline is really going to wear on the body, and it's going to cause other chronic illness and issues if we don't start to really look at that. And meditation and yoga can be really great for helping reduce your stress level and get movement in. So yoga nidra meditation apps like the Calm app or Headspace are some really good ones. Relaxing music, quiet time, and repeating affirmations. all are great forms of meditation and give your brain a break. I think that sleep is for the body what meditation is for the mind. We're not meant to just go through our days working without breaks. And so start to build in a couple of breaks, in the morning, afternoon, and evening. And make sure that you're laughing every day. Kids laugh all the time, but adults rarely laugh. And so make sure that you're laughing at least every day. And then again, you want to make sure that with other lifestyle changes that you can make, like smoking, vaping, tobacco use, or any alcohol or other substance use that you use, that can be a sign that you're really using those products, even food, right, as a way to cope with your stress. And so there may be some things that you need to address that could help you give up these things that are going to improve your health and improve your overall stress. And so, again, if you need help with these things, quitting substances, whether it's food or smoking or whatever the substance is, you often need support. And it's very important that you limit your tobacco use and all of these products, because they're going to impact your oxygen levels, and it's going to impact your overall blood perfusion and oxygenation and things like that. And so definitely will impact your overall cardiovascular health. And just in general, your overall health will improve if you're not using these products, but it does take time. And just know that once you've stopped these products, after about 10 years, your risk factors really greatly reduce to almost that of a non-smoker or non-tobacco user. So there really is benefit in giving up these substances. So that is all that we have for you today, but we're so thankful that you were able to join us and stay to the end. So thanks for letting me go over time. We would love for you to follow us. We have a website and Facebook and Instagram account, and then we have a blog that we all contribute to. So there's typically a blog for each class that I teach. And Ashley is on the call today, and she does an amazing job of running all of the social media for the office. And so definitely check us out there. And then please let us know if you have any questions. We do have health and life coaching available for free as a UA employee benefit, and you can reach out to me about that if you're interested. And I will go ahead and take time for questions for those of you who want to stay. There's a question about, is keto diet good for you? And what I would say to that is that keto diet is not inherently bad for you, but there are definitely certain medical conditions that you do not necessarily benefit from having a high protein, high fat diet. So keto can be really difficult on your kidneys and can be hard on those if you have kidney disease, if you have other chronic illnesses. You definitely want to get some clearance from your health provider, and you may even want to talk to a nutritionist before starting something that is that extreme. What I would recommend is to follow the Just Eat Real Food method. It's called JERF, and it's where you just eat real whole foods and more plants than not, and limit some of your carbs and things like that. So that's where I would start. If you add that in along with water and movement, you're going to see the same types of benefits that you would get from a keto diet without as many risk factors. So keto is one that you always want to get a personalized, stamp of approval from your health care provider, because it can be so hard on your organs, particularly your kidneys. So I hope that answered your question. All right, thanks for the information. Good. Yes, and you will get your credit. Ashley just mentioned that they can run a report to see who's been in attendance, so don't worry about that. Yes, wellness classes and screenings, there's going to be lots of offerings for that in the spring as well. And I don't see other questions in the Q&A. Do y'all have other questions that y'all would like for me to answer? Amy, this is recorded and it will be posted to the website. Give just another minute or so. Yes, the internet has been a little spotty today. All right, any other questions? All right, well, seeing and hearing none, we'll go ahead and close out for today. Thank you all so much. I hope you have a wonderful afternoon, and please feel free to reach out if you have any questions. Thanks so much for being here. Bye-bye.